Everyone ready? All right. Okay. Good. Good afternoon, everyone. I will start with the COVID update. WA Health has reported 4 new local COVID-19 cases and 11 new cases related to travel up to 8 p.m. last night, of which 1 is overseas and 10 are interstate travellers. One of the 4 new local cases is a contact of a return traveller from Tasmania who was previously announced as a positive case. This new case, case 1244, has been infectious while in the community. Exposure sites are online now and they will continue to be updated. Case 1244 picked up a family member from the airport on the 2nd of January who recently returned from Tasmania. The Tasmanian arrival landed in Perth the day before Tasmania was moved to high risk. This is a confirmed Omicron case. What we do know so far is that case 1244 did everything right under the medium risk border settings. This included mask wearing at the airport. Although not confirmed, case 1244 is likely to have Omicron, which will mean it will be the 3rd case of Omicron in the WA community this year. The exposure sites so far include Woolworths Coburn, Good Price Pharmacy Jandakot, Australia Post Collection Bentley, and Chemist Warehouse Bentley. More exposure sites will appear on the wa.gov.au site and Healthyway, so please keep checking that site. The other case is a truck driver who arrived in Western Australia via South Australia and tested positive after arrival. The other 2 cases are related to a truck driver previously reported. All new cases reported overnight are in quarantine. These cases bring the state's total number of COVID-19 cases to 1,254. There are now 100 active confirmed cases in WA and 1,138 people have recovered from the virus. WA Health's contact tracing team has identified a new range of exposure sites linked to new cases, and it is likely exposure sites will continue to be added. 4,685 West Australians were swabbed at clinics yesterday. WA Health is expanding testing capacity, including operating hours of clinics. There are many clinics available and people are encouraged to check the website to find clinic location and opening hours. Private clinics are also available and testing is free of charge at private clinics for people who have been advised by WA Health to get tested or who have been present at exposure sites at the times listed on the Healthy WA website. With the hot weather, people are encouraged to plan ahead and bring a hat or umbrella, sunscreen and water, and to arrive 15 minutes before closing if possible. And I'm pleased to announce today that we are launching our new government app that will help with WA's safe transition. The app is called Surface WA. It will change the way people connect and access services through the state government. The Service WA app is free, convenient and secure mobile application. It allows West Australians to show proof of vaccination, check in with Safe WA at businesses and venues, and to access their G2G passes for interstate travel, all in one convenient place. It also helps you access important COVID-19 information, such as how to prepare your household for COVID-19, what financial assistance is available, where to get tested, where to get vaccinated, and exposure sites. Using the Service WA app means you won't be opening multiple apps or carrying other forms of identification to enter venues and events. It's all in one place. Importantly, the Service WA app, you won't need to show identification with your COVID-19 digital certificate to enter businesses and venues like you would with a certificate stored in your digital wallet or hard copy. This is because you use a digital identity to set up the Service WA app. Your digital identity helps you prove who you are online, meaning the app is safe, secure and not accessible by anyone else. Setting up your digital identity does take some time. By doing this, it's important because it means your identity is properly verified and secure. Allow at least 30 minutes to complete it at home, and make sure you have easy access to forms of identification like your passport, driver's licence and Medicare card. Also make sure you have a MyGov account linked to your Medicare service. There are step-by-step how-to guides on the wa.gov.au website to help with this process and other avenues of online support. It is a bit fiddly, but there is huge benefit to getting this done now. You only need to do it once, and once you've set it up, you'll be able to check in with Safe WA, show your proof of vaccination, and stay up to date with the latest COVID-19 information. You won't need to log in every time, and this will make entering venues and events much quicker and more efficient, like the footy, music concerts and festivals. And importantly, using Service WA app will make life easier for businesses and their staff. By registering with the Service WA app, you'll be setting yourself up for future access to other government services, and these will be added over time. So I encourage all West Australians to download and set up Service WA today and familiarise yourself with its features as we approach our safe transition on the 5th of February. I'll now hand over to the Vaccine Commander.
Thanks, Minister. You don't have to look too far to know that Omicron has impacted very heavily across the world and indeed across Australia. As the Minister has just announced, there is a case now of a close contact of a person who has confirmed to have Omicron, and while we've not yet got the full testing back of that contact, that person has been in our community for the last few days. We believe until at least the 5th of January, the person has visited a number of sites, and I'll repeat, please check the Healthy WA website for those list of exposure sites. Omicron is a game changer. It does mean our lives will change. It will not be the same as it has been through the last 2 years of the pandemic. So as we are now entering a different phase of this global pandemic, we are asking West Australians to continue to do what they have been doing, and that is cooperating, understanding that the best protection you can get is if you get vaccinated. We are now, with this announcement, with Service WA, making it much easier for West Australians to go about their life in as normal a way as possible in this pandemic. By this app in Service WA, you can enter premises. You don't have to produce bits of paper or your driver's licence. It's all on the one app. And I commend the people who have developed it. It is world-leading encryption. It's got features in it which have very good privacy, very good security. This sort of information will not be accessible to, for instance, police. It is for health purposes only. It is for your protection and those of your loved ones and your family. The app is easy to use. I just used it, as did the Minister, as we came into this venue here. It takes a couple of seconds. So once you've uploaded, as the Minister's already outlined, there's a bit of a rigmarole in you uploading, but what we do know is that 64%, that's nearly 1.5 million West Australians, have already downloaded the MyGov and the Medicare type of information. And once you step through the process, I ask you to go to the wa.gov.au website and look at the instructional video, and you can take about 25 to 30 minutes. If you're like me, you might want a 16-year-old to help you, but you'll get your way through it. Once you've got that downloaded, it will work quite easily for you and help protect not only you, but those around you. With the G2G process, that is also available on this app, and that will be accessible by police, but that is a feature that is exclusively added on to the Safe WA, so that's an added feature. And as the Minister has expressed, there's a lot of other information which will be of use to you as we all work our way through this process. The use of the app is voluntary For those that don't have a smart device, you will still have to produce a form of identification and manually fill in a written register. For those of you that are used to scanning on the QR codes, we strongly recommend that you use this, download the app on Service WA, and you'll find it much easier to go about your normal way of life or to enter venues such as hotels, cafes and those sorts of places that we are asking for you to do this. It's also easier on the venue operators and the people that have to manage this. Please use this responsibly. We don't want people to be aggressive to the people that are trying to run their businesses. We've all got to be patient and compassionate with each other about this. Don't blame staff. They're doing the right thing, and we want you to support that. In terms of vaccines, an update here is that we're now over 94% on first dose for 12-year-olds and up. We have now well exceeded 86%, heading towards 87% for the double dose of 12 plus. And pleasingly, the strongest uptake is with the third dose. The third dose, we're well over 300,000 people. It is climbing every day, and we're well in excess of 14%. I expect we'll go beyond 15% when the numbers come out today of people that have received 3 vaccine injections. We're also under strong demand from the 5 to 11-year-old age group, where parents and carers are taking children into the clinics, to the GPs and to the pharmacists to receive the child dose. It's really important for their protection, and again, there's lots of information you can download on that. I strongly advocate that parents, carers and indeed anyone that needs their first, second or third dose to all book through our Vaccinate WA website. This will make it easier for everyone, including those that have been queuing in the hot weather. Far better if you book, and that way we can manage the flow through. All of our clinics are very busy, and what we don't want is people waiting unnecessarily for hours in the sun. We want you to use common sense, book on Vaccinate WA, and we'll find it's easier for everyone. I might just give one quick update in regard to the bushfire down at Eagle Bay. This is uncontrolled and uncontained, and it is a significant concern for those people that live in the Eagle Bay community. It's too late for you to leave. You must follow the directions of fire and police and remain in your homes until further advised. If your home catches on fire and the conditions become unbearable, you need to get out. Obviously, we have a lot of assets down there. There are over 150 firefighters, a large air tanker with smaller aircraft are assisting the ground crews. We have vehicle checkpoints in and around Eagle Bay itself, but it is a very serious situation. We want people to listen to the warnings and to heed the warnings of both fire and police, and you can check on the Emergency WA website for further information. I'll repeat, it is too dangerous for people to leave the Eagle Bay town site itself, and we are expecting a wind change this afternoon, which could also adversely impact on the way the fire has gone to date. With that, I'll hand over, I think, to Max.
Hi guys, thank you very much for coming to the Windsor Hotel today. We're delighted with the new app launch. We think it's going to make life a lot easier for everybody in the industry. I think it's been a sort of interesting couple of weeks, but we've got through, and I think this is the way forward to make sure that we're all compliant, everybody's doing the right thing, checking in, and yeah, keep it up. Thanks to the government for launching such a good app. I was shown it this morning by the person who sort of invented it, and it said it took him 6 weeks to make it all. So I got the sort of 5-minute sort of showdown on how to do it. Don't ask me to do it again though. But yeah, thanks for coming guys. Cheers.
Before you go, so what is it about it that'll help you in the start of this environment? Probably just have a look that way.
So the good thing about it is it combines the actual certificate with the check-in, and the biggest issue we've been having is we've been asking customers or patrons for 3 separate certificates, and of course that's infuriating. Now it's just that with a click of a button we can simply see all that, and it just changes everything. I think there's a lot of clarity now as well with the digital certificate, because it also shows people don't have to provide ID, and asking sort of someone who's slightly older for an identification, I think sort of sometimes is a bit awkward.
Do you think you'll have to have someone at the door to do it, or are you happy that people come in,
So-
check in, and then you can ask them randomly as they go to the bar? Or whatever?
We've had our bartenders and our managers do it. So our bartenders, no wristband, no service. Most of you are wearing wristbands today. That indicates that you've been checked in by our staff members. On the weekends, we do obviously have security, and they are checked then. But it's important that everybody has a yellow wristband, and also if people, let's say your girlfriend or boyfriend gets you the first round of drinks or the first meal, we have somebody walking around the floor at all times, ensuring that everybody's got a wristband, and that's how it's got to be.
Max, just on the practicalities of that, I mean, what's to stop someone using their mate's phone? As I've given you now, don't have to show a driver's license, there's no photo on the app. How are you going to know that it's the right person showing you?
I suppose that's the difficulty part of it. Face ID, I guess when they use their phone also, I mean, I guess that falls into the patron's responsibility, I think, in short, because we're doing everything right. We're following the rules, and if someone's going to break the rules and give them some, another form of sort of proof, then we can't stop that, unfortunately. We've had to turn a few people away, and we've had some interesting conversations and opinions and beliefs, and I think, we've at this stage we've lost some customers, but we've also won some customers. 8% of the population still have had still haven't had their first vaccine, and I care about the other 92% who have, and I think that's what I've got to focus on, and leave the opinions out the door, and we'll welcome the customers and patrons who have done the right thing.
Not to give the minority too much fuel, but what has been the worst that your staff have caught?
Luckily, we just don't accept any form of sort of bad behaviour. We just, they can't come in, they can't get a drink, they can't get something to eat. They'll eventually leave very swiftly, that's how we've dealt with it.
Has that been difficult for your staff at all?
We've had, as I said to the Minister when she came in, she asked me the same question. There's always one, and of course there's one difficult person, and we try to deal with it in the best way possible, but we believe that this new app will iron out these sort of bad instances. Thank you. I'll introduce you to Bradley Woods.
Afternoon everyone, Bradley Woods, CEO of the Australian Hotels Association. We've welcomed the state government's launch of the Services WA app today. It will streamline the process of checking in, checking ID and ensuring that someone has had their vaccine requirements fulfilled. The app is important because it will also make it a lot easier for hospitality operators to check that someone has met the vaccine mandate. The simplification means that we're not checking 3 forms of identification or certification. That's occurred over the last week, and we're appreciative of the government very quickly and swiftly putting this new system into place to try and create a much easier process for guests and patrons checking in to bars, pubs, hotels and other hospitality venues. As the Premier indicated yesterday, it's likely that this app requirement and the mandate is going to be extended across many other businesses and hospitality businesses, and I think we can accept that this is going to be the norm. In other states and territories and other parts of the world, it is the norm to check vaccine requirements, and we're anticipating that over the forthcoming weeks, if not sooner, that's also going to occur in Western Australia. So our message would be to the people who love going out and enjoying hospitality to download that app, fulfil all of the technical requirements as quickly as you can and have it ready well before you go out to a hospitality business. We don't want to be dealing with it at the door, we don't want to be dealing with it at the bar. Please do it in advance, and that's going to be the best place to have it done. I did it myself this morning, had it operating within 2 or 3 minutes, checked into the venue today, very swift and efficient. So congratulations to the team who've put that together. Over the last week, as Max, the licensee here, has indicated, there has been some aggression from members of the public who don't want to cooperate, and that will continue to be the case. But well over 90% of Western Australians understand the need for vaccination, understand the need to support their fellow citizens and go into an environment in a safe manner, and this is going to be the norm for all of us going ahead. We all wish the pandemic didn't happen. We all wish the inconveniences that come with it didn't occur, or the health and the deaths that have occurred, but it's a reality of what we're dealing with in this environment now. And we would certainly be saying to people, download the app now, get it in place, and it'll be a lot more easy and smoother way of going out and enjoying your favourite bar or hotel. Thank you.
Just in terms of you, I think you're aware, or someone wants to talk to the security issues, because for example, those 3D movements on
So I'll invite the Minister now to come back and answer those technical questions.
I'll do my best. One of the decisions that was made was that the West Australian app would rely on the Commonwealth identification. The West Australian app relies on the Commonwealth identity requirement through the MyGov or the MyID app. So it is one of the highest standards in terms of verifying people's identity. Other states have used their check-in app and then asked people to upload proof of ID, if you like. So we've chosen a system that is more robust and more secure. So you can be very confident that when someone actually produces the app, it has the government shield, which has the government crest, which is shimmering. It has a time clock, and it has a moving tick that is a genuine and authentic proof of identification held by that person.
That's a screenshot. Couldn't do that.
Correct. You couldn't take a screenshot of our proof of identification.
Without photo ID, as I said to Max, what's to stop people passing their phone down the line to unvaccinated mates to get away with still getting bar service and things like that, and using someone else's tick to pretend they're vaccinated?
I think they'd have to be very determined in that case. I mean, most people use their phone for absolutely everything now. When they go to a pub, they'll come in, they'll check in, they'll show their vaccine certificate, and then they'll go to the bar and use their phone to pay. So I think that staff will probably be vigilant. Venues need to take reasonable steps. If they see that occurring, then they'd obviously have to look at whether they can provide those people entry.
And what about people who don't have a passport, don't have a driver's license, or don't have a phone?
Well, there are alternatives. So you can provide your certificate, you can provide hard copies. They are all still legitimate proofs of vaccination and identification. So all of those methods remain. But what we're doing here is providing a one-stop shop for businesses to check and for customers to use.
How do you feel business?
No, Safe WA will still operate, but we would urge people to move to Service WA. So Service WA talks to Safe WA, if you like, so people could continue just to use that app, but we would urge people strongly to actually download the Service WA app. The app will be improved in its functionality over the coming weeks and months. As flagged previously, this is the first part of the portal, of the kind of online portal for the West Australian Government, so we would hope to have functionality that would allow people access to licence renewal, for example. So this will be part and parcel of people's everyday business.
How do you feel this app is to have it as a one-stop shop? So can people be assured that if they leave their hard copy of their passport or licence at home, that will be taken as law at the door?
So the purpose of the app is so that people don't have to bring that documentation. So that all of that identification is verified at the back end in the establishment of the app. So you will absolutely, if you've got that app on your phone, that is the authentic and robust proof of ID and vaccination.
Applicants still have the right, though, to ask for proof of identity to match a photo if they have reason to query?
They have the right to take reasonable steps to verify that identification, so yes.
And on that, could a business say we're only accepting that, or will they be required to accommodate whatever you need?
Look, we encourage businesses to put in place measures to protect their customers. they could make that determination, but that would be a decision for the business.
The Safe WA app was restricted from police access. I assume police will have access to this app for the purpose of enforcement?
For the purpose of enforcement?
Or to be able to enforce people who do refuse to comply? Does that sound
No. Sure. The Safe WA app is subject to the same privacy legislation that was passed at the end of last year through the Parliament. So it is only available for the purposes of contact tracing. They will have access to the G2G information, which has always been the case.
So how will vaccine proof of entry requirements be enforced?
Well, police will be doing spot checking, and the Commissioner will probably be able to answer these questions in more detail. There will be also government regulators, so there will be police available doing spot checking at venues. Other government regulators, such as environment regulators, will be available to do spot checking of venues, but ultimately it is a shared responsibility of patrons and venues to take reasonable steps to provide that information.
So does it say in the privacy information that it might share information with law enforcement, so that would be only around COVID-19 or G2G?
That's correct. The G2G information already is shared with the police because they manage that app. That's their app and the data that they require in managing people coming in and out of the border. But the contact tracing information, the Safe WA check-in information, is only available for the use of contact tracers.
When can we expect to know what other venues will fall under the vaccination restrictions?
We'll be announcing those in the coming days, but as the Premier has flagged, we will be expanding requirement of vaccination, a proof of vaccination requirement across a range of venues, cafes, restaurants, gyms, so on and so forth. The reality is this pandemic is not going away, and this is the new normal. This is the new normal, and I urge people to download the app today and get ready for providing that proof of vaccination. For those who are not vaccinated and are eligible to be vaccinated, I urge them to get vaccinated so that they can get on with their lives and do all of the things that they continue to do today.
Minister, you just mentioned cafes, gyms and the like, which the Premier said yesterday as well. Why isn't proof of vaccine required to enter aged care? I have to have the flu vaccine, but not the COVID vaccine to enter a place where the people most vulnerable to COVID are.
Aged care is run by the Commonwealth, so we are waiting on a decision from the National Chief Health Officer's body to make a decision on aged care. My preference is that all visitors to aged care are vaccinated, but that is a decision for the Commonwealth. So we are working with them and working with the State Chief Health Officer to ensure that is a decision that is made.
Does that need to happen before February 5? Because we're still seeing a higher rate of deaths in aged care.
My view is it needs to happen as soon as possible.
You mentioned that the app is quite fiddly. You mentioned the app is quite fiddly. We're getting a lot of feedback from the public that it is sort of like having a lot of trouble downloading it, finding it, and then trying to access all the parts that are needed. What's your advice? What's your response to that?
Oh, there's two parts to that question. I'll answer them in two parts. So in terms of finding the app, the more people that search for the app and download the app, the higher it will go on the App Store. So there isn't any way to put that in a particular order on the App Store. It's done by popularity. So we'll be sending out links via social media, emails and other communications for people to directly download the app. And as that becomes downloaded more, that will be easier to find. At the moment, I think we've got about 6,000 downloads, and that was before even we've launched it formally. In terms of actually downloading it and then filling in the requirement, the Service WA part of the app is not the difficult part. The more challenging part is the MyGov and MyID. So it's the Commonwealth part of the app, which is the identification verification. So you really need to make sure you've got all of the access to all of your identification to be able to do that. You do have to move through a couple of apps while setting it up, back and forth from the ID app through to the Service WA, I did it in about 5 or 10 minutes, and I would urge people just follow the prompts. If they're having difficulties, there are videos, there are online videos on the wa.gov.au site, there are fact sheets, and there is a call centre. So 1333 WA is the helpline. We also have a big team on board to manage any issues, any glitches. This is new for people. Every state that has rolled out this app has experienced hiccups, but we want to hear about those, so make sure you're feeding it back, and we'll make sure that team is improving the app as we go.
Can I ask how much it was, how much it cost?
The app's taken about $2.1 million in development.
Is that on top, is that within the existing contract with Genevieve, or is that an expansion on the 6 million already?
I would have to probably get back to you on that information.
There's about 20 exposure sites that have been added today. As I was saying, Genevieve is still on the area of Omicron. Is there a pretty strong likelihood that there has been spread of this quite transmissible virus now compared to the security guard situation?
I think there is a strong possibility there's been community spread of Omicron, given some of the exposure sites that have been visited. I want to stress that the person who most recent infection has done nothing wrong under the directions that they were given. This is just part and parcel of managing a really aggressive strain of this virus. So it is possible that there could be community spread, which is why I strongly urge people to check those exposure sites and go and get tested and isolate until you get that test result. The more testing we have, the more tests that people are doing, then the better chance we have of detecting it in the community and managing it quickly.
Just to confirm, the one close contact with the higher security guard who lived in the same house as the female who worked in the healthcare setting, any other people around that person at this stage tested positive? To my knowledge, just that one close contact is the only positive. You're saying there's no other at this stage?
That's not the information that I have at this stage.
So there's a possibility. So there's a possibility now that Omicron's kind of been spreading around. Keep getting told the kind of plans that we have to be ready for February 5. Hospitals will be in place by February 5. What's still left to be done? Not only just awarding a contract for a telehealth GP system, with hearing different things from nurses about maybe being asked to do 2 weeks in a hotel while they're working 2-week shift or things like that. What's actually still left to be done in preparation for Friday?
An enormous amount of preparation has been undertaken over the last 2 years to prepare our hospitals and to prepare the broader community for the potential of a spread of COVID-19. That includes the recruitment of 1,200 nurses since January last year, about 450 doctors last year into the system. We continue our international recruitment. I mean, the more time that we have, the more we are able to recruit through over and above our international cap, and that work continues. The beds, and certainly those hospital beds, continue to come online and will come online progressively throughout this year through to October. So the system will recalibrate should there be an outbreak, and the system will focus on where it needs to and support those patients where it needs to support them. We do want to be able to continue business as usual through the health system so that we can continue treating people as they present to the health system. And the longer that we have to do that, the better it is in terms of managing an outbreak. One of the reasons we're experiencing a really steep increase in demand last year and the beginning of this year is because we've really experienced delayed care in 2020. Lots of people were afraid to come to hospital and have delayed their care. So what we have is more people with more acuity, and that's taking longer to deal with in hospitals. So there is work being done in the hospital system, and it will recalibrate to support COVID within the community and in the hospital system.
Just on
Nurses have been
this,
asked to cancel their leave come February 5.
Sorry, I missed that.
Nurses have been asked to cancel their leave.
Look, annual leave is managed by hospitals and services and service providers based on the requirements of delivering those services. So I'm not aware of those cancellations, but that is really a matter for those services to manage it, to ensure continuity of service. I do want to say we value our healthcare workforce, nurses, midwives, doctors, hospital support staff. There has been staffing shortages and people have been doing longer shifts. We appreciate that there is a bit of fatigue. We appreciate your work, we continue to appreciate your work, and we will support you through this safe transition.
Just on Pete's question, sorry. Victoria today reported its highest number of hospitalisations since the start of the pandemic. The Premier yesterday said he hadn't seen modelling around Omicron. How can you be confident that the hospital system is prepared when the modelling is based on Delta and Omicron is what we're dealing with?
We expect to see modelling around Omicron in the next couple of weeks. I think the high number of hospitalisation is reflective of the sheer volume of cases that are coming through in Victoria and New South Wales. We will be putting in place public health social measures prior to February 5 or at around February 5, and our high vaccination rates. So the best thing that people can do to protect themselves is to get their third dose, and if you have eligible children, to make sure that they get vaccinated as well.
The Nurses Federation is calling for the border opening to be delayed a month to March 5, saying that we need to wait until after the peak over Easter. More grad nurses will be looking more experience within that month. What are we going to
February 5 is the date that we're working towards. I'm happy to work with the ANF and other bodies to work through their concerns. As I said, the best thing that people can do is to make sure they get their third dose and that they get their children vaccinated if they're eligible.
What's your message to people who might not be eligible for their third dose before the border comes down? So there's quite a lot of them out there.
The vast majority of people who we expect to be in contact with COVID-19 will be eligible by the time of February 5th. That was one of the reasons the Premier took a very strong view to National Cabinet that be brought forward, that eligibility period be brought forward to 4 months. By January 31st, that eligibility period will be 3 months, even shorter. So we expect the vast majority of West Australians who are required to be vaccinated will be eligible for their third dose.
We open up in a few weeks, so if they're only getting it on the one week in a few weeks, how good will that be to reopen, and how much time do people really have to where the restrictions will be?
One of the reasons we have been in such a good position in Western Australia is we've been able to look carefully at what has happened in other states and other countries, what's worked and what hasn't worked, what's put strain on the system and what's worked well. So we're doing all of that work and we're watching carefully. So it is a moving feast. It is an ever-evolving situation and we are continuing to watch it. We will take the health advice as that evolves, and certainly February 5 is the date that we're working towards. We do know that those third doses are some of the best protection against Omicron, so I'm urging people to get their third dose.
What would be your number one lesson learned from the interstate experience?
I think for me, watching what's happening over in other states is making sure that you have both the high levels of vaccination rates and the public health social measures. I think decoupling those two has created issues, particularly in New South Wales. So having both of those things in place is really important in terms of managing the flow of the virus.
Will there be extra restrictions on the vaccinated as well as unvaccinated?
There will be broad public health social measures to slow, limit and prevent spread. That will go across the community, whether it's vaccinated or unvaccinated. But I'll make the point that if you are unvaccinated, there will be significant limits on the things that you can do and what you can engage in.
Questions for the Commissioner?
So the government said about 950,000 people will be eligible for their third dose come February 5, so that's less than half of the West Australian population. We're saying that a third dose is the best protection that we have against Omicron. Why aren't we taking the time to see that number, get that number higher? What's the economic versus health balance that's being discussed either by the show or by the emergency group making decisions to go ahead and doing that?
these decisions are made on the best available health advice, and that's what we will continue to do. So we've made these decisions based on advice from the Chief Health Officer, and we will continue to make decisions based on that advice to keep people safe in Western Australia.
The gap between boosters and half, initially 6 months, coming down to 3 by the end of January. Dr. Omicron has previously said that a larger gap between your second dose and your booster has to maybe give longer immunity, like better immunity long term. While the booster has been shown to help against Omicron, people have now had that choice taken away from them that they want to have their longer term immunity or get the booster, especially with it now being forced to the pandemic.
People can choose to get their booster whenever they can. If you're in a mandated group, then you are required to have your booster. We know that it will protect you from Omicron, and we know that it will provide significant protection, not just for yourself, but for the broader community. That's based on the ATAGI advice, which is the body tasked by the federal government to provide advice on vaccinations, and that's the advice that we take when making these decisions.
How will the vaccine-proof part of the Service WA app be enforced? Given what I'm thinking of is that, in pubs, Max and his staff are used to turning people away with redundant days, but staff at gyms and cafes and the like aren't used to turning people out, will probably need police assistance. Will police have access to all the information in the Service WA app, and how will it be enforced?
Okay, a couple of comments to put this into context. 2 years ago we didn't have a pandemic, and I'd proposed that 2 years ago West Australians weren't used to using quick response codes, QR codes. We didn't use them. Now we have 1.5 million West Australians who are registered and are regularly using it. We had 1.5 million uses of a QR code yesterday. So we know that West Australians have adapted, and we strongly believe that West Australians will adapt to this new Service WA app. In terms of enforcement, police are prevented by law from examining, even using a warrant. For instance, if we're investigating a homicide or a serious crime, police will not be able to access the Service WA health contact tracing data that's in this new app. The G2G app and the information about G2G will be accessible by police, but not the health-related data. In terms of enforcement though, if someone breaches this, well, one, if they're coming to a venue like this, it's going to be a very expensive drink. It's a $1,000 infringement for someone that wants to try and game the system or hand the phone off to their colleague. They risk a $1,000 immediate fine or a $50,000 fine if you're caught fraudulently breaching an Emergency Management Act direction, which is what this is about. Again, I'd stress it's for the protection of everyone. So one, don't use someone else's phone. Two, if you do, you run the risk of a $1,000 on-the-spot fine or a $50,000 court fine. There's very good security in there, but police will be doing spot checks and the environmental health officers will be doing spot checks, but I'd repeat what's been said here already. This is a shared responsibility by everyone.
Pilbara, Kimberley, Gascoyne and Goldfields, do you believe they will aim to take the same like Feb 5, or are there going to be some of those that might get there?
Well, look, the Pilbara, the Kimberley and the Goldfields are the three regions that have the lowest present vaccination rates. We are seeing good increases, but they've got a way to go. So we've already foreshadowed, if they don't reach an acceptable level, up to at least 80% vaccination in those regional areas, they're likely to suffer consequences which will be different from, e.g. the Perth metro area. The Perth metro area and indeed across Western Australia, we've got first doses in excess of 94%. So if you're living in the Pilbara, Goldfields or Kimberley and you haven't been vaccinated, I can foreshadow that there'll be restrictions that will prevent you from gaining access to certain premises, such as licensed premises. There may be restrictions on travel. That's why we have been impressing upon people, get vaccinated, and if you choose not to, then you've just got to live with the consequences of that. Yes, you'll still be able to buy food, but you may not go to sporting events, you may not go to cafes, unless you comply with the rules that may have to be put in place in regional areas as well.
When the border opens and visitors coming from interstate, are interstate apps accepted, or do people need to download the Service WA app? Is the Service New South Wales app accepted?
Yeah, they'll have to use the Service WA app, but there is compatibility because, as Minister Sanderson has already said, we use the same digital download information as the Commonwealth, so it's very easy to actually upload. If you've got a compatible digital download already through your MyGov account, etc., then it's only within minutes. As Bradley Woods has already said, it's very easy to download if you've got the requisite background information.
How many on-the-spot fines have been given since the vaccination?
Look, the overall number of infringements, not for proof of vaccination, but the total of infringements since the pandemic started is just over 800. And that's because we've been getting great cooperation from the community. Now, that's not about production of vaccination, that's the totality of people who at times have not worn masks or they've breached some emergency direction. I can tell you in other parts of Australia, it's in excess of 50, 60,000. So our approach here has been with the consent of the community, and that's what I repeat quite regularly. If we do this with the public understanding and consent, we get the outcomes that we've been achieving. We've got the best protection, and we've got now 100 cases that the Chief Health Officer has advised us this morning that they're monitoring. That's active cases. And you juxtapose that with other places in Australia, it's very sad. New South Wales have just gone over 500,000 cases today. That's 500,000. So it's a very, very different situation here in other places, and we want to try and keep it that way as long as possible.
Any infringements being issued for the vaccine?
Not that I've been briefed on, no.
And just the fires, can you comment on that? That we have had some concerns. I know these have been allayed in previous instances, but with regard to new vaccine requirements, people are asking if they're unvaccinated, can they go to the evacuation centres?
Yes, look, in an emergency situation, we don't want people to be doubting, can I go to a safe place? You go to a safe place, a vaccination sort of certificate is not required to go to an evacuation centre. It's an emergency situation down at Eagle Bay. Your safety and those of your loved ones are the primary concern for us. Don't worry about the Safe WA QR code, just get to a safe place if you're able to. But I will repeat though, for residents in Eagle Bay at the moment, the advice from DFIS, from the fire and emergency experts, is do not leave unless directed by a fire officer or a police officer. There's no information that's deliberately lit. But look, let me stress again on the basis of that earlier question. If your life's in danger, obviously you must leave and leave if your house is on fire. I'm not saying stay in your house, but what I'm repeating is that the fire and emergency warnings it's very dangerous at the moment, so monitor the Emergency WA website. And in terms of the vaccination certificates, don't worry about that, we'll sort that out later. There is no information that this fire has been deliberately lit. No, the information I've received this morning is that in respect of the truck drivers, all affected people are in quarantine, and there's no information I've got that says that there's a concern for community cases.
Just one more. Warraloo, there's been some more spot fires up there. What would you like to say to people who are deliberately lighting those?
Well, if you're deliberately lighting fires, our Operation Vulcan, our arson squad, have a very high catch rate in terms of that. We're putting specific effort for arson specialists and local police in and around the Warraloo area. We do consider a number of the fires there have been deliberately lit. If anyone responsible is watching and listening to this, don't do it. One, it's criminal. Two, people could lose their lives. So, that's quite obvious, but unfortunately, some people just, do criminal acts. So we're very concerned about it. We're putting a lot of effort into it. Thanks very much.
No, you're right. You're going to do what you're going to do.